Do you often feel unusually tired, gain weight without changing your food, or notice your periods coming very late or not at all? What if acne keeps coming back, even after trying many creams? These might not just be random issues. They could be linked to a common, but often misunderstood condition called Polycystic Ovary Syndrome, or PCOS. Imagine your body is like a team, and all parts, brain, hormones, ovaries, need to talk and work together. In PCOS, the messages get mixed up. The ovaries, which release eggs every month, grow many tiny fluid-filled sacs called cysts, but these aren't dangerous cysts. It's more like the eggs aren't being released regularly. This causes hormonal chaos, leading to the symptoms many women face. About 1 in 10 women of childbearing age has PCOS, so if you or someone you know struggles with irregular periods or unexplained weight gain, it's more common than you think. Why does this communication breakdown happen? That's what we call etiology, the cause. Think of insulin like a key that helps sugar enter your cells for energy. In PCOS, your body might become resistant to insulin, so the key doesn't work well. Your pancreas then makes more insulin, and high insulin levels push your ovaries to make more male hormones like testosterone. Even though women naturally have small amounts of these, too much causes issues like facial hair or acne. Genetics also play a role. Did your mom or sister have irregular periods or struggle with fertility? That increases your chances. Inflammation in the body from poor diet or stress can also worsen it. So it's not one single thing. It's like a chain reaction. Genes plus insulin issues plus inflammation equals PCOS. Let's play a quick game. Say yes if you've experienced any of these. Irregular periods like skipping 3 months, heavy bleeding, acne on your chin or jawline, extra hair on your face or belly, hair thinning on your scalp, or sudden weight gain, especially around the waist. If you said yes to a few, it could point to PCOS. But here's the twist. Some women with PCOS have regular periods but still have other symptoms. Others may not show obvious signs, but struggle to get pregnant. Mood swings, low energy, and dark patches on skin like on the neck are also clues. It's like your body is sending you warning signals, but they're easy to ignore or blame on stress. The key is connecting the dots, because treating PCOS early helps avoid long-term problems like diabetes or heart issues. How do doctors know it's PCOS and not something else? They don't just rely on one test, they use a combination. First, they ask about your periods, symptoms, and family history. Then, they may do a pelvic exam or ultrasound to check if your ovaries look polycystic, many small cysts. But guess what? You don't need visible cysts to have PCOS. Blood tests check hormone levels, like testosterone and insulin, and rule out other conditions. The diagnosis usually needs at least 2 out of 3 things: irregular periods, high male hormones, symptoms or blood test, and polycystic ovaries on scan. Treatment isn't one size fits all. If you're trying to get pregnant, medicines like Clomid help release eggs. If not, birth control pills can regulate periods and reduce acne. For insulin resistance, a drug called metformin helps the body respond better to insulin. But the real game changer: lifestyle, diet, exercise, and sleep. For example, walking 30 minutes a day and cutting sugary drinks can significantly improve symptoms. Can you prevent PCOS? Well, since genes play a role, you can't fully stop it, but you can prevent it from getting worse. Think of it like managing a garden. Even if the soil has a tendency to grow weeds, PCOS, you can pull them early and plant healthy seeds. Eating whole foods like veggies, nuts, and whole grains, staying active, managing stress, try deep breathing or journaling, and getting good sleep are superpowers. Avoid crash diets, they can make hormone swings worse. A teenage girl with irregular periods who starts walking daily and swaps soda for water might delay or reduce PCOS symptoms. Parents, this is where family support helps. Making healthy changes together beats forcing change alone. Science is making cool progress. Researchers are looking beyond hormones to the role of gut bacteria. Yes, the bacteria in your belly might affect PCOS. Some studies show women with PCOS have different gut microbes. Could fixing gut health with probiotics or fiber-rich foods help? Possibly. Others are exploring anti-inflammatory diets and new drugs that target insulin and hormones more precisely. One recent trial found that a drug called GLP-1, used in diabetes, helped women with PCOS lose weight and improve ovulation. There's even interest in using AI to analyze ultrasound images or symptoms for faster, more accurate diagnosis. So while there's no cure yet, the future looks hopeful, with personalized, science-backed ways to manage PCOS better than ever.